Hey everyone, it's Kit Cabello of hardlensmedia. We are wrapping up the DSA single-payer healthcare debate and forum that was happening here. We are joined here today with one of the main organizers who was helping run our Facebook live stream event. So essentially, can you please introduce yourself to our viewers and subscribers?
Yes, my name is Clara Alcott.
So, Clara, obviously, single payer healthcare is an important issue that's affecting a lot of Americans, and DSA is taking it as its primary platform, especially as we enter the 2018 and 2020 primaries. Uh, Essentially, for our viewers and subscribers, why is it that single payer healthcare is such a powerful platform that DSA wants to use?
It's that we actually we did talk a lot about single payer today, but we as an organization have endorsed Bernie Sanders' bill Medicare for All. In Chicago, we do work often with the Illinois Single Payer Coalition. We believe, I think that locally we think that single payer is a little more aggressive and a little bit it covers more that we need. The Medicare for All right now does not provide extended care. So either way, we just feel that there needs to be healthcare reform. We are working officially towards Medicare for all, but something needs to change.
Now, of course, there are critics who are saying that Medicare for all, single-payer healthcare, it's impossible, it can't be done. And we even have like establishment Democratic leaders like Nancy Pelosi who refuse to really support anything in regards to reforming healthcare. Essentially, what is really needed to get reform to be passed, especially if there's going to be Democrats and Republicans who want to halt any kind of reform?
Well, I don't know. As a democratic socialist, I'm a little tired about the status quo in the Democratic Party. They need to be working for people's needs, and they need to be considering that instead of just disregarding the need for healthcare reform. And I have lived my entire life with the burden of a very difficult healthcare system in the United States, and we need to change. There needs to be dialogue. There needs to be communication by legislators and the public. And I think as democratic socialists, we're ready to organize. We're ready to get out and start canvassing, and we're ready to work. And I think it's possible.
Now, of course, there's also the misconception that corporate media, the way it's portrayed, single payer and healthcare reform, that it's going to be an impossible task and that it can't be done. Of course, what has been your outreach towards communities, especially communities that are really hesitant in supporting healthcare reform?
Well, the thing is, I've not personally met anybody who does not want healthcare reform. I've not met anybody. And the DSA has had a lot of discussions about things that we want to work to change locally and nationally, and healthcare is always the number one priority. It's always the number one priority. And when I have conversations with coworkers and friends, we are burdened by our current healthcare system, and we do need to change. So honestly, I have not met anybody who is not interested in a change. I mean, I hear of people, legislators like Illinois Democrats who have not signed on to the Sanders bill. I don't know why, but we need to change.
Of course, there's on Q4 Radio, we do talk a lot about healthcare and stories relating to healthcare reform. And of course, with the current system, the way it's set up, one bad day, someone is bankrupt, they lose their job, and they're incapable of really getting the proper treatment that they need. How can we effectively really bring forth real change and reform this system, especially if there's a lot of lobbying influence, especially from the pharmaceutical industry and other large corporate entities that really want to stop reform?
Well, I think that we need to just start trying. I think communication is important, communication within the public, or locally in Chicago, and educating ourselves, essentially what we were doing today. We needed to learn we just needed to educate ourselves about how corrupt our healthcare system is. And we feel that if we are able to communicate and educate our community, I think that we can work towards change.
Now, perhaps there's going to be more events like this in the future. Where can our viewers and subscribers learn more about these events? Where can they find you guys on social media?
They can find us at Chicago Democratic Socialists. There's a Chicago Democratic Socialist Facebook page. There's a Northside Democratic Socialist Facebook page and a Southside Democratic Socialist Facebook page. And we also have our own website, chidsa.org.
Well, we're looking forward to covering more events like this, and hopefully there will be a much more larger dialogue here in the United States in regards to healthcare reform.
Yeah, of course.
Peace, everyone.
You're watching Hard Lens Media.